suppose the question that I need to ask you is this. You have come all this way from St. Catherine's. Now, the question is this. On what would you like me to help you or to teach you?
Well, my practice is limited to oral medicine, oral facial pain. I get a considerable number of patients with mouth lesions, which is another area that I biopsy and treat. But another major area of my practice is dealing with patients with facial pain, and most of this facial pain is associated with, quote, temporomandibular disorder. Now, you said TMJ, and this is what a lot of doctors in the public say, TMJ, which means temporomandibular joint. But it is a TMD, which is a temporomandibular disorder, which encompasses the musculature and the as well as the ligaments of the joint and the jaw that move the jaw. And I have found that if I can teach the patients how to deal with the musculature, because these patients have a syndrome of symptoms. They have headache, they have migraine, they have difficulty in putting their teeth together, have difficulty in chewing, and all this is associated with the muscles of the head and neck region. And invariably when I examine these patients, I will find trigger points in the muscles of the neck, in the face, and in the temporal region.
My sense is that you would like the information from me about hypnotherapy for pain relief.
Yes.
Is that correct?
Yes.
Okay. The thing is this. When we deepen the trance, the usual protocol is to verbalize them going down a set of stairs. So as they go down, 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 the words are hopefully to take them down deeper into the trance. As you say it, they visualize themselves doing it. And by the analog maneuver, they are therefore going to deepen their trance. Now then, what researchers have realized is that this iterative metaphor of going down the stairs is really quite passé, because what is far more important is to get the person to go inwardly into yourself. You must go deeper into yourself. If you get the person to say, now go inwardly into yourself, deeper, deeper, deeper. Logically, where the hell do you think he is going to go to? You see, if you go into yourself, you're going into really the infinity of your inner reality. So where are you going to go to if you're going inwardly into yourself? You're obviously going to go to your center, the center of the self. And if you agree that the inner reality is an infinity, who or what do you think is at the center?
My soul?
Right on the button. The light of God in you. You see, every hypnotist directs people to go down the stairs to that dirty room down there. What Jennifer and I found was to direct the person to go to the center. Now then, and when you go to the center, what do you think is the quality about the center? What we have found is this. When they reach the center, the person themselves will have the awareness that their higher self is there. What we have found is this. If they then, in their eagerness, want to go to the light of God, it will always pull back. What you have to get them to do is to do nothing and let the light, and be open, and let the light of God come to them, and they are as one. Now, there are two. The light of God is not this. It is living. So you get the person, right, to sense how the light of God moves. And once the person is moving with the light of God, then you tell them, now move in rapport with your higher self. The light of God vibrates with life. Sense that. And once you sense it, vibrate in sync. And then this is the most critical thing you must do. You will tell them to allow their inner ear to open across all wave bands. Turn up the volume. And then they will hear a piece of music. The music will come, and the music will have a beat, a rhythm, and a timing. And that rhythm, melody, rhythm, beat, and timing of that piece of music will be exactly the same as this. And when you go in with the music, go into the flow, you will now fully be in tune and in harmony with the light of God. Equals non-dominant hemispheric excess. Now he's thinking by music. He is now operating by the non-dominant brain. Now that is a profound shift. And when you get that shift, the pain will go. True or false?
It's true, sir.
Tom is here because I have to see him this morning. He has multiple myeloma, a condition that is incurable. Have you had pain since, Tom?
No. As soon as we do the consultation, we're good to go again.
You don't have any pain?
No.
This is where hypnosis has come to.
It's not what I expected.
Therefore, if you can do this, you can reverse a cancer.
You can reverse the cancer.
I have done it already. He is the second cancer case.
That's amazing.